Hello and welcome back to PET, the Principles of Exercise Therapy, lecture number 14. We go from muscular hypertrophy to the heart. So let's go back to our centering slide. What is physiotherapy about? It's about human anatomy and physiology, human movement and function, maximizing wellness and potential, minimizing injury, and ultimately solving real-world problems. That's our mission statement. That's our goal. Okay, so from this session, the hypertrophy to heart, we're going to describe how exercise affects the heart. We're going to learn how exercise exertion can be measured, and we're going to explain the concepts of how exercise provokes and prevents. So we go through the principles of exercise therapy. We've got a sport billy, that's the way we remember it, and we've got adaptation, specificity, progression, regression, overload, reversibility, taking time out, behavioral change, individuality, lifestyle integration, law of diminishing returns, and ultimately it's your responsibility where the patient takes ownership for their own health. So exercise is a paradox. Okay, it has a dual role of provoking in the short term, which is going to increase your heart rate, but in the long term, it's going to lower your resting heart rate. So therefore, it's good for you. And we're going to take the guidelines from the American College of Sports Medicine on cardiovascular activity or cardio-respiratory activity, the heart and lungs. So heart is a muscle and it's going to adapt to the imposed demand, the specific adaptation to imposed demand, the SAID principle that we gain from exercise as medicine. So what we're doing when we prescribe exercise is we're giving a dosage. And to measure that dosage, we use the acronym DRIVE. So we're going to think about the duration, the rest and recovery, the intensity, the volume, and which energy system we're trying to predominate. So DRIVE, always remember that acronym. So the heart and lung metrics. It's important to know what is roughly the average. So an average heart rate for a normal human being under no duress is roughly 72 beats per minute. Okay, you're going to get some athletes that are below 60 beats per minute, and you're going to get some people that are above 90 beats per minute. But 72 beats per minute gives you that average that most people are. Respiratory rate, this is how many breaths you're taking per minute, and this will vary between 12 and 20. So 12 to 20, the average being 12 breaths per minute. Stroke volume, okay, this is to do with the milliliters per beat ejected from the heart, okay, and that's going to be 70 milliliters on average. And then in terms of cardiac output, okay, liters per minute, which is the cardiac output, okay, that's something like 5.25 litres per minute. So it's quite a large volume of blood going around the body. Blood pressure, average blood pressure measured in millimeters of mercury is 120/80. Okay, so as you can see, diastolic, which is the 80, that shouldn't change too much with exercise intensity. But systolic is going to change significantly with exercise. Okay, so just remember that. It's the systolic and the diastolic. So what is the heart? Okay, it's effectively a 4-chamber muscular organ that pumps blood around the body. Okay, there's 2 circulatory systems. The systemic, that's blood going through the body, and then the pulmonary, that's blood going to the lungs to get oxygenated. So blood in the pulmonary circulation exchanges carbon dioxide for oxygen in the lungs through the process called respiration. And the systemic circulation then transports oxygen to the body and returns carbon dioxide and relatively deoxygenated blood to the heart in order to get reoxygenated from the lungs. Okay, so this is what's going on here. Okay, so you can see that there's 2 systems going on here. Okay, oxygenated blood and deoxygenated blood going on through there. Okay, and that's a nice way of showing it. Okay, right, so the heart and the lungs. So blood needs to get oxygenated before it can be pumped around the body. The right heart collects the deoxygenated blood from two large veins called the superior and inferior vena cava. Okay, on the left side of the heart, oxygenated blood is returned to the left atrium via the pulmonary veins. Okay, a tale of two pumps. Okay, so the heart pumps blood around the body. Is this true or false? I want you to think about this, and then we'll come back and ask you at the end of the lecture. Okay, remember, we've got two systems going on. We've got oxygenated blood and deoxygenated blood going around the body. Two circulatory systems. Okay, so we're going to come on to the lungs now. Okay, so obviously we've got openings in the mouth and the nose. Okay, that's going to go all the way down to the throat, then the trachea, and the trachea will branch off into two bronchi, okay, leading to the left and right lungs. Okay, and then inside of the lung, okay, you can see the bronchioles and the alveoli. Okay, and you come on to more of that in the second year when you do CRAM, cardio-respiratory assessment and management. So the cardiovascular system serves 5 important functions. It's going to deliver during exercise. Delivers oxygen to the working muscles. It's going to oxygenate blood by returning it to the lungs. It's also going to transport heat, which is a byproduct of activity, from the core to the skin. It's going to deliver nutrients and fuel to the active tissues, and it's also going to transport hormones. Okay, so regular exercise is going to increase the efficiency of the cardiovascular and cardiorespiratory systems. So when we're thinking of getting physical, we have an anticipatory response where the heart rate begins to increase just in anticipation of doing physical activity. It's mediated through release of neurotransmitters, okay, epinephrine and norepinephrine, also known as adrenaline and noradrenaline. And although the heart rate increases rapidly with the onset of activity, providing exercise intensity remains constant, the heart rate will level off. Okay, and this is known as steady state heart rate, where the demands of the active tissues can be adequately met by the cardiovascular system. Things like going out for a jog, cycle ride, going swimming, going walking. So the heart during activity, you're going to have increased heart rate, increased stroke volume, therefore increased cardiac output. And we've got optimal zones that we train in. But before we do that, okay, we've got to remember that exercise is this paradox. It's going to prevent in the long term and provoke in the short term. So we've got some heart rate charts here. Okay, so this is for your resting heart rate. Okay, so if you're between 18 and 25, okay, if your heart rate is above 82 beats per minute, that's poor. Okay, and if it's below 50, you're probably an endurance athlete. Okay, so it's quite a small range, isn't it, between 50 and 80. Okay, but we can see that we can work with you depending on where you are according to your age. Okay, obviously the older you get, okay, the harder it is. Okay, but you can still get fit people all the way up into their 60s, 70s and 80s. It's all about training. So measure your resting heart rate now, and according to your age, mark yourself from athlete to poor. So heart rate training zones. Okay, roughly we're going to use the 220 minus your age as a safe maximal heart rate. Okay, so for a 60-year-old, what I want you to do is work out what this would be. Okay, so you've got a 60-year-old, okay, what is their maximal heart rate? Now work out your own, so that's 220 minus your age, okay, and that's your maximal heart rate. Now what's the difference between your maximal heart rate and the 60-year-old's maximal heart rate? Okay, and just write that down. Should be quite a difference. So we've got to perform a cool down, okay, because what happens is your systolic pressure, blood pressure, is going to drop really rapidly. Okay, and this rapid drop, okay, could cause you to have hypertension or blood pooling in the legs where the vessels were dilated during heavy exercise. This blood pooling reduces the venous return, okay, and thus decreases cardiac output, okay, and can make you sort of black out or feel unwell. So it's the reduction in CO2. If it's severe enough, you might get lightheaded due to the fact that you've got insufficient blood flow to the brain. For this reason, a cool down period is always recommended, particularly following any exercise, particularly intense exercise. And what you want to do is drop that heart rate below 100 beats per minute, allowing the stroke volume to recover and readjust also. So just monitoring that outcome measure of heart rate at rest, we want it below 100 beats per minute. Okay, so lungs during activity. So the lungs are going to bring oxygen into the body, and they're going to provide energy, remove carbon dioxide, and remove all the waste products created when energy is being consumed. So the heart is going to pump the oxygen to the muscles that are doing the exercise. So what happens is you might have an increase in your accessory muscle use. So using the fibers of the upper trapezius, you might see the shoulders rise up and down. Okay? And when someone's breathing as well, they're basically using those accessory muscles to help with the breathing. They're going to increase the depth, okay, and the rate of breathing to get that oxygen in. And what we used to define as aerobic fitness is your VO2 max, your maximum oxygen uptake. This is the maximum amount of oxygen that your body can process during exercise. So when you exercise and your muscles work harder, your body uses more oxygen and produces more carbon dioxide. To cope with these extra demand, your breathing is going to increase about 15 times, okay, than it is at rest. Okay, so that's a significant amount. Okay, so you're going to have lots and lots of air going through the body, trying to oxygenate the system, and your circulation is also going to speed up to help with oxygen to the working muscles. Okay, so how do we measure effort? So we've obviously got our pulse or our resting heart rate, okay, going from 72 beats per minute to whatever our maximal heart rate was, 220 miles per age, breathing from 12 to 20 breaths per minute, all the way up to however many breaths we need. Also, how does somebody look? If they look ill or unwell or red in the face, that's going to give you a good indication of blood being shunted from the core to the peripheries. And then we're going to come on to the RPE, the rate of perceived exertion, also known as the Borg scale. It's a scale from 6 to 20 if it's the Borg scale, or 1 to 10 on the rate of perceived exertion. This is how hard the person thinks they're working. We could also measure their blood pressure, and a new one on you will be the MET, okay, the metabolic equivalent of task, and we come on to that in a second. Okay, so the Borg scale goes from 6 to 12. 6 is no exertion at all, okay, and 20 is maximal exertion. Okay, so it's always worth checking where they are on the Borg scale. You want them working about 13, between 12 and 14, which is somewhat hard. Okay. We've also got the rate of perceived exertion here. We've got very light activity all the way up to max effort activity. And these are your heart rate training zones. Okay, you often hear triathletes talking about staying out of zone 5. Okay, which is 90% of your heart rate max. You want to stay down here if you're doing endurance activity. Okay, so that gives you a 1 to 10. So whether you're using 6 to 20 or 1 to 10, make sure people know what they're doing. So the metabolic equivalent of task, the MET, this is a physiological measure expressing the energy cost of physical activities and is defined as a ratio of metabolic rate and therefore the rate of energy consumption. During a specific physical activity to a reference metabolic rate set by a conversion of 3.5 milliliters of oxygen per kilogram per minute. So the MET is used as a means of expressing the intensity and energy expenditure of activities in a way comparable among persons of different weight. That's why it's so useful. So although the resting metabolic rate of any person is going to deviate from this reference point, the MET can be thought of as an index of intensity of activities. For example, sleeping takes 0.9 METs. So you're still burning energy just to keep you alive, just for your metabolism to do all the stuff it does while you're asleep. Okay? If you're just sitting still okay, sitting at your desk, 1.5 mets. Okay, this is why we're likely to put on weight if we sit all day. Walking is between 3 and 4 mets, depending on one's speed. And then something like 8 to 9 mets is when you're running. So we can see watching TV is about 1 met. Okay, and if you're doing some skipping, that's about 10 mets. Okay, so you can see the difference about why we're all putting on weight. Okay, simply because we're all down here in about 2 mets almost every hour, whereas we need at least an hour to be up here at the 10 met activity. Just out of interest, sexual activity is only 5.8 mets, depending on what you're doing, obviously. Okay, high intensity interval training. This is the new wonder drug of exercise, HIIT training. Okay, now this is an intense form of cardiovascular training, so your patients can't just do this to begin with. They've got to build up to it. And it's an enhanced form of interval training where you're using short bursts of activity with less intense recovery periods. So this can be anything between 4 minutes and 30 minutes. Okay, and we come on to things like Tabata from Professor Tabata's training work. Okay, we exercise for 20 seconds, 10-second rest, and then you repeat that 8 times. So that's 4 minutes. Okay, and these short, intense workouts, okay, are really going to improve your athletic capacity and basically your general fitness. They're pretty tough though. Okay, so by the end of this lecture, we should be able to describe how the heart responds to prolonged exercise, explain how exercise exertion can be measured, and to describe adaptations of the heart with a regular dose of exercise. Okay, there's some brief terminologies there if you need it. Thanks for listening, and we'll see you in the next podcast.